What do I love about emergency medicine? I love working as a team, and the idea of everyone kind of achieving the common goal, and also knowing what we go through is special to me.
You know, I never really wanted to be a master of one thing. I always wanted to be a jack of all trades.
Thought about all kinds of different specialties like surgery and ID and cardiology.
Right out of college, I decided to scribe for a short period of time in the emergency department.
I'm seeing everybody, no matter what they look like, what they believe, what they think. Many of those who cannot get care don't have places to stay, don't have insurance.
There's this one place where I felt like the whole world was being captured in this one department of the whole hospital. I wanted that adrenaline, I wanted every little part of it.
It's exciting to me, emergency medicine. That's why I like it.
It's the coolest job in all of the House of Medicine.
I cannot think of another career that would encapsulate my personality, what defines who I am, more than emergency medicine.
So what it's like to be an emergency physician today, it's different than when I signed up for doing this about 20 years ago. The patients are different, the acuity is different, we have boarding that we didn't have before.
The amount of work we have to do, the amount of documentation we have to do, the number of masters we need to please, and the expectations of the public keep getting higher.
I don't recall also in the past there being such a shortage of staff.
We're having to provide care in areas and in ways that I believe have been hurtful to patients.
It's hard. Often you start every visit with an apology. I'm so sorry, ma'am, that you've been in the hallway for 2 hours, but let me try to help you today.
When you multiply that problem by even 4, 5, 6 beds at a time, that can become really dangerous and disheartening.
That feeling of being completely powerless, seeing sick people in the waiting room have horrible outcomes, either cardiac arrest in the waiting room, missed serious complications of their disease.
Our systems aren't built for about 1/3 of the patients that show up.
You know, we just had a psychiatric patient that was in our emergency department for over a week. You know, that kid ended up being transferred actually to another state. That's how difficult it's been.
Housing instability, their medication refills when they can't afford, the copay, or addressing chronic medical conditions without the ability to get into primary care for a repeat visit.
All of those things add up to this problem of burnout.
I think we are sometimes likely to just gloss over things or pretend that we are okay.
Because of that kind of raw emotional toll, you may not have as much of yourself just as a human being to give. And that's how I have felt when I've been burnt out. I think I withdraw more.
I dreaded going into every shift. I would walk into the emergency department and I would count down the hours until I left.
That feeling of not caring and not caring about your patients, about your coworkers, about yourself and your well-being.
I think one of the drivers of burnout is this sense of loss of power, and we are just cogs in that wheel of the greater system. I would actually challenge that. We are not cogs in the wheel, but architects of the system, and we have a voice. We have an ability to change that system.
I'm always looking for solutions to try to make the situation better. When you kind of just accept the situation the way it is, it sort of feels like you're giving up and you're failing your patients. But instead, if you just turn that around and say, what can we do as emergency physicians to make this boarding situation better, then you don't feel quite as helpless.
I think the way we fight for our specialty, the way we change our specialty for the better, to better take care of our patients, is through policy.
Advocating for safer staffing.
Participating in hospital committees, participating in local, national organizations.
There is strength in numbers, and there's strength in sharing experiences. There's strength in having a common voice.
And our most potent way of working together is through ACEP.
I've been an ACEP member since 1991. ACEP has always been here to stand for emergency physicians.
I think ACEP's role is really facilitating that sense of community so that you know there's a place you can go.
ACEP is how we've advocated as a specialty since our inception.
They're the ones that have people on the ground in Washington, people on the ground at their state representatives.
ACEP serves as a vehicle by which we can impact advocacy related to policies and laws and social determinants of health and other issues that, no doubt about it, impact our ability to take care of patients.
Workplace violence bills that talk about hospital staffing and how we get reimbursed as a health system and allowing patients to get connected with outpatient resources.
I think the only way we have that be meaningful for each one of us is if we truly engage with that process.
Right now, there are many professions who are stepping back and are very disillusioned by the healthcare system. We could do that, but as emergency physicians, we won't do that. We are people who run towards danger. We are people who want to make a difference.
If we own our own problems and we realize that we can facilitate change and make it better, I think that's the first step in all of this. And then I think the other part that goes with that hand in hand is remembering that we're part of a family, whether that be your family in the emergency department or the larger emergency medicine family.
If you care for medicine, you care for our specialty, you care for our patients, you need to go out and fight for it.
Let's take care of our community and the needs that walk in through those doors.
When we rely upon each other, we'll be better for it.
This is how change happens.
We've always evolved and we'll do it again.
We'll embrace it and we'll move forward.
We are the safety net. Our society, they need us.
What we do is special.
It's the coolest job in the world.
We need to take care of ourselves and take care of each other so that we can take care of our patients.